May Habib standing by for our update with GMH. Good morning.
Good morning, Chris. Good morning, Sabrina.
Morning.
Let's just get right into it. I guess we'll start with the COVID census as things on the rise, unfortunately, over the Guam Memorial Hospital this morning.
Yeah, definitely. So our overall census at the hospital as of this morning is 180, and of those, 49 are COVID. We've been hovering anywhere around the 38 to 40 mark for a few days now, and just seeing 49 this morning was really a big shock, but not surprising considering the number of people coming into our ER who are testing positive.
So that's a pretty significant spike there, May.
I'd say so. It's been a gradual increase. Definitely, we were at 44 earlier yesterday. And we had been hovering around 38 to about 40 or 41. But, going from yesterday, 44 to 49 today, that's 5 more people, which doesn't seem huge in the grand scheme of Guam being 160,000 people. But for a hospital that, we're already at basically capacity, and we have holdings in the ER because we don't have enough beds to admit people. 5 more COVID positives who need very specific care and very specific rooms to be, negative pressure. It is a lot.
ICU level of care, those numbers?
ICU right now, we are at, let me see, care 14. We're at the maximum, which is 14.
Did you already break down vaccination on vaccinated, unvaccinated at the hospital?
Yeah, so we get a report a few times a day. This one is still reflecting 45, which was our latest number before we got our update this morning, which is 49 people. But I can tell you of 45 from last night, I went through and counted 30 are not vaccinated, 6 are partially vaccinated. So they got, one of the 2 doses, and then 9 are fully vaccinated.
We did have, I had a question on the unknown status of patients. Do you kind of know why it would say that?
Unknown status of their vaccination?
Yeah, for patients that are like GMH, for example.
Yeah, so that could be either that they're not in the GU web, the system, and I'm not sure what their status is as a patient. They also sometimes, we get people who say they are vaccinated, and then the story changes a little bit, and then they're like, actually, I only got 1 dose. Actually, I got no doses. So I'm not perfectly sure why exactly, but I know that sometimes, they have to corroborate the information, right? So if it's not in GU web and the person is saying they're vaccinated, it's kind of undetermined until they can confirm it.
Mm-hmm. Has there been any COVID-related fatalities since the last JIC?
So since last night, I think we have reported all of them so far. Yeah, there's been none overnight. But there were 3 that were reported, of course, yesterday.
Pediatrics? Any new pediatrics patients?
Still the same one pediatric who's an infant.
Wow. Any new staph infections?
We do have new staph infections. Everybody's actually getting infected outside of the hospital. And, the irony is not lost there, but because we're human too, and if it's in the community, we go home to our homes, we go to the same grocery stores, the same areas as everybody. And so if it's in the community, we're bound to be exposed as well. We do have a few new, at least one from this morning, at least one that I can report from this morning, staph. But again, it was an outside of the hospital exposure. It's somebody in their household that had it, and then they ended up being exposed. I can tell you, though, in-house, we have a really thorough and strong infection control team, which, almost 2 years into this pandemic has really honed their contact tracing and infection control skills. So in hospital, PPEs nonstop, we monitor all employee health symptoms, and that's how we're catching anybody who is possibly sick, as we have daily monitoring. It's mandated that we have to be reporting into Stera Alert. Our vaccination rates are high. There's a lot of ways that we're catching and mitigating COVID, making sure masks, I'm in a room completely alone. That's why I can take off my mask, but, masks, PPEs and all. But unfortunately, it's in the community. So when you leave here, it's out there, right? And when you go home, you're not necessarily wearing your mask constantly.
Mm-hmm. So that would be like a total of 3 this week?
I'll have to go through and count them, but that sounds about right.
Mm-hmm. What about the status of RegenCove? Does GMH have any RegenCove?
So we're actually expecting another shipment from our federal partners. We're trying to nail down the exact time that it would be coming in. It's sort of communication with the actual manufacturer in the warehouse where it is, and then with HHS as well, that's also helping facilitate this and then coming to us. I can tell you that from the GMH side, we're prepared to show up at the tarmac at the airport and collect it ourselves. And I'm not even kidding. Like literally there's, we've made the plans that as soon as it lands, we're going there, collecting it ourselves and bringing it straight to GMH so that we can put it in the refrigeration that we have here to keep it proper so that we are able to infuse more patients as they need it.
So do you guys have any RegenCove?
Right now, we do not, but we do have a backup, a different monoclonal medicine that's being used, and we do have quite a supply of that. So there is still infusion that's happening. It's just the RegenCove that's sort of been tricky to nail down. There's multiple layers of getting that over here, and as you know, generally shipping to Guam takes more precautions than, say, shipping between states and the mainland. So we're working that out, but we are expecting another RegenCove shipment, I believe, this weekend.
Mm-hmm. Okay.
Thank you, May.
Thanks, May.
Thanks, guys. Stay safe. Wear your masks. Get vaccinated. That's all we can say.
All right.
There you
Take
go.
care.
May Habib, Guam Memorial Hospital spokesperson. Thanks for jumping on this morning, May. Yep, the hospitalizations continue to rise. It's interesting what she had said about the staff infections at the hospital occurring outside in the community. And you can only imagine that we're going to be having the same conversation again when the school